Thank you and good afternoon, Mr. Trudeau. My name is Francesca Southwell. I am from the St. Mary's University Students Association. I'm also an international student from the Caribbean island of Antigua and Barbuda.
Beautiful place.
Very beautiful place. Earlier you mentioned that Canada has the highest, highest number of, in terms of education, the OECD. But we also have we rank at the bottom for physicians per capita. So we actually have the lowest number of doctors per patient, basically. And my question is all about concern about the shortage of doctors. I see that in the 1990s, there was a policy to reduce the number of medical students by 10% after the class of, I think it was 1997 or so. And then there's another issue that when it comes to shortage of doctors, around the same policies in the 1990s on restrictions on international medical graduates. I just want to know, how would the government, your government, address the shortage of doctors, and specifically these two policies? Because of course there are a number of them. Thank you.
Thank you, Francesca. First of all, we need to make sure medical schools are expanding, that there are more schools being built, that there are more places in medical schools for the range of medical professionals. That's not something that the federal government does directly. Obviously, it's the province that runs universities and post-secondary educations in their jurisdiction, but it's certainly a conversation we are having with various provinces on how we can help increase the number of doctors. One of the commitments we made in the last election was around adding to the number of doctors, particularly family doctors, across the country. The way to do that, though, is to ensure that there are more spaces in medical schools so more people can go through that and more people see the value in becoming general practitioners and particularly family doctors, because that is unbelievably important as a backbone of our system. The other piece you mentioned, Francesca, is the international credential recognition, and that's something that the federal government does have a role to play on, and that is part of our conversations that we're having with the provinces right now. Recognizing qualifications. Before I got into politics, I was a high school teacher, and I taught for 5 years out in BC, and then I chose to come home to Montreal, and I wanted to continue my teaching career, and I found out that I'd have to go back to school for a few years, even though I'd started my schooling in Quebec, to qualify, because being a member of the BC College of Teachers didn't automatically apply to being a teacher in Quebec, even though, and that's one of the reasons why there's a shortage of anyway, we won't get into it, but the shortage of fluent French teachers elsewhere across the country and a shortage of fluent English teachers in Quebec. It seems like there'd be a connection there that one could make, but that's something people are working on as well. Making sure that we're recognizing professional credentials across the country is going to be really important, and that's part of what our challenge is and what we're doing. We're pushing on the provincial bodies that are accountable to that to make sure that they do that. But there's also a process around international credential recognition that is extremely important. Now, we have to make sure that regardless of what country someone was educated in, once they hit a floor or once they hit a clinic, they are just as good and every bit at the level of a Canadian trained practitioner. We wouldn't want someone to start wondering, okay, well, if you were trained elsewhere or if you're from elsewhere, you might not give the same quality of care as someone who went to med school down the road. And that's not something we want in Canada. So we do need to make sure we're hitting those professional qualifications. But there are ways to do it much more efficiently, much more rapidly. You can start doing the training while someone is doing the immigration process, doing online courses from their home overseas so that they land and they just have to do a little practical work. There are ways to recognize credentials a lot quicker, a lot more efficiently, if there is an openness to doing that by the provincial bodies that regulate that. And that is something that is at the heart of our conversations that we're having with the provinces now, to make sure that that becomes part of the solutions, to take the pressures off the system we have right now. So thank you for bringing that up, Francesca.